So good afternoon. My name is Jim Welch. I'm the Clinical and Operational Lead for Mental Health Liaison Services here in the Acute Trust. A session as part of our Mental Health in Focus training for Acute Trust staff. And today we're going to be looking at trauma and trauma-informed care. And I'm joined today by my colleague Karolina. Karolina, would you like to introduce yourself?
Yes, hi. My name is Karolina. I work in, sort of between professional education and the emergency. I am a trauma-informed mental health practice educator. What I do is I run teaching sessions for preceptorship and the emergency department. I'm running the trauma-informed project, so right now I'm trying to gauge the experiences of staff with trauma-informed care, how much they know and how much support they get.
Thank you. So, I guess one of the first questions I'd like to ask, what do we mean when we use the word trauma? Because many of our colleagues will understand trauma in terms of broken bones or injury.
Yeah, absolutely. When I ran some of my surveys, that's exactly what I got, that a lot of people see trauma as injury. But actually, trauma is a lot in our emotional self. So basically what trauma is, it's an event or an experience that causes emotional distress. And it could be witnessed or it could be actually experienced. Anything that makes you feel overwhelmed, alone or stressed or feels threatening or is threatening can be perceived as trauma.
So it's an event that results in an emotional reaction.
Yeah.
Can it also result in physical consequences for a person?
Absolutely, yeah. So, it's dependent, but sometimes it could be due to coping mechanisms. So trauma is a lot of emotions. It's anger, shame, guilt, and it can result in different things. So I could eat less because of so much stress. I could turn the anger inwards, so I can actually hurt myself in many ways. It's what I find really interesting, that sometimes people think that exercising cannot be a bad coping mechanism because exercise is so healthy, but it can lead to over-exercising. It can lead to bad sleep. It can lead to a lot of other things. And it can also lead to bad beliefs about the world. It can make me think that something's wrong with me or something's wrong with the world. So trauma is such a complex emotional thing. A lot of us think about PTSD when we think about trauma. But actually trauma can be much more simple than that. It could be that I walk in the room and people start laughing and I feel attacked by that because I feel this is because of me. And then if I hear somebody laugh again at me, I can still think that's trauma. And I like to say that sometimes, we experience many traumas. It could be that I'm at school and I raise my hand up and somebody laughs because my answer's wrong. That's a mini trauma, but most of the time we can work through those. But just a lot of the time people don't realise that we can experience many traumas in everyday life.
So I think the concept of ACEs, of adverse childhood experience, is quite well understood now, that multiple ACEs or multiple adverse experiences can lead to consequences in terms of mental health, but also substance misuse. It can lead people to develop kind of maladaptive coping strategies. And I think ACEs don't have to be, or traumas don't have to be big, do they?
No.
They can be cumulative, but they don't have to be a single event.
No, absolutely not. And I like to use an example. It could be that a child had the best parents ever, but they were workaholics. And by the time it comes to them going to university or school, even school, they may be overachievers and perfectionists because parents are perfectionists. And then they take that, I'm not good enough if I don't work really hard. And they go into really aspiring jobs and then take all that stress. And it doesn't seem like trauma because they have a perfect life, a lot of money and a great family. But it is still trauma because of that perfectionism. But it could be also that, my parents are absolutely loving and they spend a lot of time with me, but actually at school I'm not doing well. And people pick up on that and I come back home and my parents tell me, why don't you put a little bit more work? Why don't you do that? And that lack of understanding can be a mini trauma. It doesn't have to be a severe trauma. It's not a trauma you would notice in the way that you notice a PTSD or you notice ACEs with a lot of severe coping mechanisms, but it can still be trauma.
So I guess for the benefit of people watching today, PTSD, post-traumatic stress disorder, is a particular cluster of symptoms that tends to occur when people are confronted with life or death or life-threatening situations, very often associated with the military. And that can cause the disorder itself causes changes both in emotional state but also in perception,
Yes.
and in how someone decodes the world. So in extreme cases, they actually regress to the point of the trauma itself,
Yes.
find themselves back in the emotional state of warfare, but they experience that fear in real time.
Yeah, absolutely. It's because, going back to basics with the brain, really, we have two parts, which is our frontal lobe and our temporal lobe, which are most important with trauma. Our frontal lobe, prefrontal cortex, is the logical brain, is what we use right now to talk. But in trauma, that shuts off completely. We can't think. We don't think straight. Our temporal lobe turns on. That's when our amygdala and hippocampus is our little bridge that turns on the memories, and amygdala is the part of the brain that turns on the fear and the anger. That's what switches on. It's called the lizard brain because all mammals have it. That's our just natural instinct. If something just fell off the ceiling, I'd probably jump back first before I think this fell through the ceiling. And that's what happens with trauma. We react and we stick in that reactive brain. That's why we can't think that, oh, actually, this will be okay, we can work through this. And that's what happens with PTSD. And PTSD is not necessarily just war crimes, like you said. A lot of us think about it because it's such a severe example. But it could be anything. It could be, like I said, something could fall from the ceiling and I could get traumatized by that. It could be that I will in the future be actually really scared of walking past these type of ceilings, or I will pick up on things hanging off low from the ceilings because I'll get that hypervigilant brain turned on continuously, picking up on those little things. And I like to use example of a study of Watson and Raymer. You might have heard about it, of little Arbet, and they put a little white rat in front of him who wasn't scared of it at all, but then they conditioned him by pairing it with a loud noise, and then he got really scared. And then, because of his memory, he remembered it was white and fluffy. He was continuously scared of white and fluffy things, which was a white rug or Santa's beard or a white cat, because of that hypervigilant brain, because your brain doesn't logically think that this was just the white rat. It just picks up on those little things that you can notice.
I think we covered in a previous session about violence and aggression, de-escalation skills. It's really interesting to hear you say about the lizard brain, the amygdala, and how that hijack takes over the logical centre of the brain, shuts off, and you're literally stuck in the emotion and the memory. So I guess in terms of practice, what might traumatise staff, let's say in the emergency department, which I know where you're doing your work?
Absolutely. So a lot of things. It could be that a patient comes in and it's something that actually hits home. It feels like, oh, my family member has gone through something so similar. And now it affects me a lot because I know what they've gone through. I think recently when I was doing my teaching with some emergency department staff, they mentioned that it's really difficult when they see people and they assume the worst because they've seen the worst. And they think, oh, I know that if it's this, they're going to have to go for all this treatment, and that's so horrible, and I know how horrible it feels, and I know how long it takes, and just knowing the whole process, that could be traumatized. But I also know they have really horrible acute emergencies, like a dog bite quite recently, or children coming in, old people, and young people their own age. That's really horrible when you see somebody who's suffering and they are your age, and you know that this is something you can go through.
So what are the signs that I may have been traumatised in my work? What do I look out for?
So usually people look very tired, overwhelmed. There's some people who just show some sort of different signs. If you see somebody who's usually very chatty, but they seem quite withdrawn that day, they come in and they're keeping more to themselves. Or sometimes people who aren't very chatty, they actually come in with a smile. They say, you know, I'm feeling okay today, but there is not much digression into actually what's happening with their lives. What I like to say is, it's so important to name how you feel. And if somebody just says, yeah, I'm okay, or not too bad, that doesn't give much into what you're actually feeling. It's such an evasive answer. So maybe good to look out or just ask and sort of dive deeper into that. Or it could be that somebody just mentions something little that could be bothering them, and they don't usually mention that. So for example, it could be that they say, oh, you know, I had such a difficult day yesterday, and it could be such a good opening sentence. Often people look tired, they might not sleep well, so you'll notice signs of tiredness. Or you may notice they're actually focusing on something way more than they should. Sometimes they're trembling, or sometimes they just eat less, drink more, or eat more because it's such a soothing mechanism, or come in late, or leave work late, don't take their breaks or take too many breaks. There's such a fine line, and it's so difficult to spot, but it's just unusual behaviour. But also sometimes people just act the same. So it's really, really difficult to gauge. So the conversations are so important. And also sometimes maybe just stepping in and saying, would you like to have a conversation? Could we have a little chat before we start work? Not even an official chat, just with people. And I know it sometimes helps. There are times when I've come into work and people just sat really quietly, and you say, you okay? And they just really want to talk. But there is not that opportunity. And it's so important to remember that I know that if I see that somebody's struggling and I ask them if they're okay and they don't want to tell me, I feel a bit worse. Most of us really want somebody to tell us when we can see it. So, but a lot of us have that sort of feeling that if I'm struggling, I shouldn't tell anyone and burden anyone. But we know from experience that we want people to tell us. So it's like a piece of advice that if we want people to tell us, we should also learn to tell other people.
So if we're modelling being trauma-informed, firstly what we need to do is to be open about our own emotional state.
Yeah, absolutely. Yeah. Like I said, when I'm teaching, I cannot just teach something that I don't practice. And I like to tell people, try to get enough sleep. I know with the work we do, it's so difficult. But actually, our brain functions for 4 hours whilst we go into sleep. It's still process everything from the whole day. So if we only sleep for 6 hours, we only get about 2 hours of rest. So we need to practice that. So I need to practice it myself to show it off. So if I have those shortcomings and I don't do it, then it's not really worth me teaching it. And I like to tell people, take 5 minutes, and I do that every day, is to go through excuses saying, I love art, but I don't have time to do it. I don't have time because I'm doing work, I'm doing stuff after work, and there's so much going on with my life. But actually, I can waste 5 minutes on my phone. I'll probably go on my phone and get distracted and do something else. But what we can do is actually take this 5 minutes to do something that we enjoy, that's going to soothe us and bring us back into that nervous system and calm it down, because that's what you have to do. Like I said, trauma is in the nervous system. It's a lot of emotions. So tap it into that, and soothing those emotions can be really, really helpful. And 5 minutes goes by so fast. If I scribble something for 5 minutes in that day, even if it's the ugliest thing I've done, I know at the end of the day I've done something I enjoy. And if I don't take that 5 minutes, I'll go to bed knowing that I didn't have time to do anything that I enjoy in that day. And it could be so powerful taking that 5 minutes.
So it's that permission to self-soothe, to self-heal.
Yeah, absolutely. Yeah, and you can do that through the day. There could be little things that you can do through the day. I know a lot of us in the work we do is the saying, I don't have time to take a break. I don't have time to do this. But actually, maybe there's 5 minutes where you can stop and talk to a coworker just about how your day is going. There may be 2 minutes, but that time can be really, really important, and it can really soothe your nervous system. And we get stuck a lot in I don't have time, and a lot of times we don't, but it can be so powerful in that really quick, fast-paced environment to have that minute to just talk and let out that I'm actually really frustrated. It's such a busy day, but I got this. Yeah, and it could be so powerful.
And I remember something the Trust introduced during COVID was the concept of wobble rooms, which where you got emotionally overloaded, you could literally go into quiet space. And I know the emergency department had red cards, which you could show to a colleague that just was a really simple way of saying, I'm struggling here and I need either to talk to you or for you to find someone I can talk to.
Yeah, that's really powerful. Yeah, absolutely.
That's something I think is really important to maintain, because from a trauma perspective, that actually gave staff permission to struggle and also said your struggle is real.
Yeah, absolutely, because that feeling of safety during trauma is really important. Like I said, anything can be traumatic. I could come into the room and just see somebody looking at me funny, and that's how I feel. I'm already traumatized, because that's such a subjective experience. Somebody else might absolutely not be traumatized by it. So if I need that safe space, it's really important. And finding that feeling of safety in such a busy environment is really, really difficult. So we're really responsible of helping people find that feeling of safety. And those are definitely the best. This is a really amazing way to do it. And it's really great that we can actually teach people that, you know, we can be each other's feeling of safety. We can help each other bring that safety. Like I said, it doesn't have to be a place. It could also be a memory. It could be that, you know, I think about home and I think about my cats and that makes me feel happy. Or I think that actually I used to have loads of fun with my grandma when I was a child, and the memory of her makes me feel a lot better. Or that I just see a familiar face in that whole chaotic world of working, and I see that they are doing fine. They are tired as much as me. And even though that's not an amazing experience, feeling tired or overwhelmed, but if I come back to somebody and I say I feel overwhelmed and they share that, it can be so empowering that they share that. That could also be a feeling of safety, that I'm not alone in that.
And if I were a manager, which unfortunately I am, but, what would I be looking for to identify trauma in my staff?
Yeah, so I'd say conversations with staff on regular. I know managers have to do supervisions anyway, so take that time to talk to them about their experience, watch what they do, and also be open to conversations. A lot of the staff doesn't feel comfortable talking to management, and it's not because the management's not great, it's because it is such a feeling that as a professional you shouldn't feel down about things that you have to do professionally. And it's such a common theme that a lot of people feel, I am a professional, I should be resilient to this, or I've done this for so many years, why is it suddenly affecting me? So just being open and honest and actually saying to people, you know, I am open to listening, even if it's a stupid question. But also sometimes maybe you notice that they're going on a break early or at a different time. Or they brought different type of food that they would not eat. Or they actually say to other co-workers that, you know, McDonald's is not for them, but they suddenly start buying McDonald's. That's such a weird example. But yeah, sometimes people just start into unhealthy habits. Or actually, I've worked with somebody who went to the toilet a lot for a wee, but that was because of stress, because they needed to actually go to the toilet a lot more often. And you know,
it's quite a contained space as well, isn't it? To box your emotions in.
Absolutely, and it's such an escape. It could be a safe room, because sometimes it feels like a safe room because it's not official. Nobody actually labels it as a safe room, but they get to have that private space. But allowing that sometimes is really good, but obviously over a period of time, if some symptoms change, if somebody actually suddenly starts isolating themselves from the group they would normally talk to, or they would talk to you about something, now they don't, there could be a lot of little behavioural changes that you should watch out for. And sometimes it's really good to give it time. Sometimes it's not. It really is very independent, because occasionally it could be, for example, my partner decided not to go because he can work from home. He decided not to go to work for a couple of weeks because we got a new cat, and he was absolutely stressed about it because, well, that's a third cat. There's a lot of cats, and it's a rescue, so it was very challenging. So for those 2 weeks, it was actually easier for him to stay home, and he didn't want contact and support from other people because I was there to support him. But if he went to work, he'd be stressing about the cat at home. So actually those 2 weeks working from home was more beneficial for him than going in and talking to anyone at work. So it's really, really subjective.
I know I talk to people about taking an internal temperature reading. Where is my stress? Where is my panic today?
Absolutely.
You know, am I in my coping mechanisms or am I out of them? Absolutely. And what can I do for myself to return to a more healthy state of being? Yeah, so like you said, it's a very internal thing. I love the idea of embodied processing. I don't know if you ever heard about it. It's a very, very new strategy instead of therapies. It's just tap in how you feel where you feel. So for example, when I was younger, I used to get a lot of stomach aches when I was stressed. And then I started stressing about getting stressed so I don't get the stomach aches. But what helps is tapping in that actually this hurts here. Why does it hurt here? Because some people say, you know, when you have a broken heart, your heart hurts. So why does this specific area of your body hurt? And just paying attention to that can be really helpful, and tapping into it. Why is that the specific area that hurts? Some people get headaches, but that's because they probably sit a lot in their head and they overthink it. Or your stomach, because
because you're actually, you're taking it in too deep. So just working through that can be really great, because often trauma is not necessarily a memory. I like to say an example that even on Monday I spilled some milk in the morning, I was already running late for work and I had to clean that up. I'll carry that stress with me to work if I don't stop and calm myself down. I'll carry it to work, then I'll fall out with my manager or my co-worker, and then I'll carry it on. And for a whole week, by the end of the week, I will not remember about that milk, but I'll still have that feeling inside of me. So working through those feelings is really important, stopping and thinking, why do I feel like this? And also identifying my emotions. A lot of us, like I said earlier, we say we're okay or we're not bad. We don't name the emotions, and that doesn't give you room to actually explore what you feel. And if I say, actually, I'm feeling nervous, I'm feeling stressed, or I feel overwhelmed, I can work through that. I can actually do something. It gives me room for answers, because if I feel overwhelmed, then it gives me room to say, actually, I need to maybe break it down, or I need to step away and take a breather. But if I say, oh, actually, I'm just not okay today, that doesn't really give me much room to work through anything. And so I find this really important. And also there's a lot of self-hate with trauma, and a lot of room for telling yourself, I did something wrong, there's my mistake, there's something wrong with me. I like the exercise of, what would you tell a friend? Would you really tell a friend that's an issue? Because we're very quick to criticize ourselves, but would you criticize somebody else for something you just did, for the mistake you've just done? Probably not. So why are you so kind to others when you're not so kind to yourself?
And we talked a little earlier about neural pathways, but I think our internal language is also incredibly important, isn't it?
Absolutely.
And I find that particularly the words should and must.
Yeah.
I should be able, or I should have, or I must be able, or I must do. Actually, how fair are those words when we're applying them to ourselves, and would we apply them to other people?
Yeah, absolutely. When I used to work as a wellbeing practitioner, I used to call it the shouldn't curse. I should and I could, but actually, should is such a wide word. Why should I have to do this? Or I must. It's such a heavy word, and you put so much expectation on yourself. Yeah, and it's so challenging, and you expect yourself to be that kind of person, but actually you should take everything one step at a time. Do goals you can actually achieve. Like I said, for example, I should do my washing, or I should do this, I should do my dishes. But actually, I should, yes, but I don't have to. I can take it one step at a time. Like I like to say, I sometimes leave my laundry lying around, but I am proud of myself that I put it in the washing machine. Yeah, so just one step at a time. We should praise ourselves for little things we do, not put too much expectations on ourselves, because it's really, really challenging. If I tell myself by the end of the year I'd like to be a millionaire, if I don't win the lottery, it's not very likely. And I might actually be really down if that was really, really my goal. And I tell myself I should be doing better, I should be playing more lotteries, I should be doing that. And then I don't win, and that's not necessarily my fault. But I told myself I should, because other people can. Yeah. So achieving those small goals that are really genuinely achievable in everyday life can be really great. I know a lot of people have that, mainly in the job we do. We want to be good people, we want to be liked by people. This is the job we do, we're caring people. And a lot of people say, well, I should be liked by people. People should really like me. But actually, it's not an achievable goal. We can't be liked by everyone. You could be the most amazing person, and then people will hate you because you're so amazing. So that acceptance, and I love radical acceptance, which is so difficult. That sometimes word is not fair, but we have to accept it. Because if I stick myself to, well, it has to be a certain way. Why is it not a certain way? It would be better if it was a different way. Then I actually put so much strain on myself. Like the should. Sometimes we don't have to. We just have to accept that certain things can be a different way. They don't have to be the certain way we like them to be. And unfortunately, that's how the world works. And it can be so helpful to accept things.
So what does the trauma-informed project that you're part of, what are we aiming to achieve?
Yeah, so it's a 12-month project for now. I'm about 6-7 months in. We're hoping to gauge how much trauma-informed care staff is aware of. For now, we released a mini survey that has received about 43 responses, which is quite good for acute care. And we understood that, well, a lot of them see trauma as physical, which is really helpful because it helps to bring us up to basics that actually, because they work so much in physical, they don't actually see it as emotional and they can't really notice it in themselves. So what I'm trying to do is understand how much they know and how much do they actually notice in themselves and others. And interestingly, a lot of people do notice it way more in other people than they notice it in themselves. And well, this is really helpful to then understand the teachings which I've built, and I've initially done it in preceptorship. So I taught some trauma, what trauma is, and I actually had a great feedback. Then I took it to the emergency department. They were fantastic, and they gave a lot of ideas of what we can actually do to change. So what we're trying to do is understand it, and then hopefully bring in the change that they need. And a lot of them said that actually that little debrief at the end of the day would be really helpful, or have somebody to talk to, or just basically have more understanding of what's going on with them. And providing those teaching sessions have actually received such a fantastic feedback that they feel more hopeful, that they actually see what's wrong with them. Well, not what's wrong with them, but what could be happening to them. And they can understand that this is what's happening, this is what I can do. And noticing things can be really powerful. Like I said, noticing your emotions. If you name it, you can do something about it. And that's the same with trauma. If you actually notice it, you can do something about it. So teaching people how to notice it, how to work through it. Knowing that if you're agitated, overwhelmed, or if you actually come into work and you feel, I used to be so caring, and now I walk in and I don't feel like I care for these people. I don't have as much compassion as I used to have. And a lot of people struggle with that. And that's just because of overwhelm, and telling people that actually it's okay. It's a very normal symptom. It's not nothing that's wrong with you. It's generally just that things like that happen. If you feel overwhelmed, your own emotions are overwhelming you. So you cannot generally give them up to somebody else. And it was so empowering to share that with people.
I guess the concept of vicarious trauma.
Yes.
So experiencing trauma, but through the trauma of others.
Yes.
And compassion fatigue as well.
Yeah.
Is often, people often talk of having compassion fatigue. But I think if I'm reading what you're saying right, well, actually what they have is trauma. Yeah. And they're locked inside their own trauma and can't reach out to others.
Yeah, absolutely. Because, you can witness trauma. Most of the staff here doesn't necessarily go through trauma. Some of do, of course, but some of them just witness it. Like, they have a lot of patients with a lot of different experiences, and they work through it. Sometimes they weren't even in shift, but the other staff has experienced something, and then it becomes a shared trauma because they talk about it, they work through it together, and then they get burnt out really quickly if you witness everything and you don't have that time to de-escalate, because trauma is stored emotional energy. It flows inside of you, goes into a little cycle. If you don't break through the cycle, if you don't have time to actually calm down your nervous system, you keep that trauma inside of you, and it leads to burnout really, really quickly. If I'm at this level of stress every single day and I don't get myself time to de-escalate, I will eventually choose to actually leave my job, or maybe change department, and actually never work through it. And I get myself to a different job for another burnout. So it's really, really important to get that de-escalation going really, really quickly.
Something else from an organisational perspective maybe is to look at, what's my staff turnover like?
Absolutely.
How many vacancies have I got, and do I continually have repeating? Yeah. Because that can be a good indicator of the trauma within the overall workforce.
Yeah, absolutely. I have currently got access to some turnover rates, which hopefully by the time we get the trauma project rolling, we can see that maybe the teachings we're doing, we're hoping to also do training for different bands, and we'll see what's going to be accessible and cost-effective way to deliver certain things. But we're hoping to deliver those teachings and some trainings, and hopefully once that's delivered, the turnover should decrease slightly. There is a chance it could increase, because if people realise, oh, actually maybe this job's not good for me, and they might leave. But either way, it is a good eye-opener for people to see this is what's happening to me. And it is good really for management and for work to help people realise that. Because like I said, if you continuously at high level, the best change is to leave because you feel this is what's happening to me. I need to leave the environment. But then you carry this stress over. And it's possible they already come with stress from previous jobs, from previous departments. So working through that is quite a key element.
Fantastic. So what would that mean for me? Let's say I'm a nurse in the emergency department.
Yeah.
I'm knee-deep in all sorts.
Yeah.
What would being trauma-informed mean for me?
Yeah, so trauma-informed means knowing and understanding that we don't always have a memory of what necessarily happens, but we have the feelings, we have the stress inside our body, and working through the stress is really challenging, and not open it up in a situation where you cannot actually work through it. So I like to say to people, I'm always open to talk, but if you don't feel confident that you can actually work through those difficulties, you shouldn't actually open it up because you can de-traumatize another person that you're talking to. But yeah, so it's really important to understand that that's how I feel, work and understand those feelings. I know there are great people that you can talk to. There's a Hub 2020 and the staff psychology. However, I know there's a lot of stigma going to those places. Mainly if you're a senior member of staff. I know right now there's a lot of ideas that, I'm a professional. I've been doing this for so long. But actually, if you've been doing it for so long, it can build up over the years.
Probably accumulated more trauma.
Yeah, absolutely. So it's really good to know that you can talk to those people, but actually maybe talking to a colleague can be really helpful. There are online services that you can talk to as well. But what I can do is hopefully we can open a little intranet page with some strategies on it, which would be really, really great. And just working through those emotions, naming emotions. If that's how I feel, that's where I feel, that's what I can work through. Grounding strategies are amazing. Not everybody loves them, but they're really amazing. And talking to people. However, talking can be also questionable. If you talk about memory, you can be traumatized. So what's really, really important is to talk about the emotions. It's how I feel right now. And am I safe right now? Am I going to be safe? Because if you talk about something, but you come back to work tomorrow and you still feel unsafe at work, that's not really helpful. So maybe talking to management or colleagues, how can we create that safe environment where I can actually feel safety? Because a lot of staff, I heard that they're on shift or they're doing something, they start feeling overwhelmed, but they feel like they cannot escape. There's nothing they can leave right now, so they have to stay with that stress. So how can we manage it where you can actually offload from somebody? Yeah.
So the overall aim is to create a resilient workforce.
Yeah.
A staff group who understand their own and each other's emotional states and are there to support each other.
Yes.
So actually you're not trying to add complexity, you're not trying to add extra work.
No.
You're simply trying to help people to exist and survive emotionally.
Absolutely. It's just understanding that people have emotions inside of them, something that's very subjective to them. I might not understand what they're feeling, but I know they're feeling it. Yeah, because if, for example, somebody's going through something, they lost a house. I've worked with somebody whose family lost their house. I don't necessarily understand it because I've not gone through this, but I can be understanding of the situation. And sometimes it's really important not to say, I understand how you feel, because it could be more agitating if you've never gone through it. But being understanding of the situation can be very helpful. And just being there to listen, because sometimes we don't have answers, and I know sometimes I don't need answers, but just listening. And I said to my partner once, I was going through a difficult situation, and that was some time ago, and I said, you know what, I don't know if I should leave this situation or stay in this situation, and I just want you to validate me. I don't want an answer, stay or leave. I just want you to say, it's okay if you stay, because this is something that's important to you, but if you leave, that's okay, because you're keeping to your boundaries. And that's sometimes the only validation you need. You don't actually need an answer, you just need validation of both choices.
Yeah, and that's important, isn't it? If someone approaches you, it's not about you solving their problem or giving them a solution. It's about hearing them and just being okay with hearing. Absolutely,
and being okay that sometimes we can have a trauma of very conflicting emotions, because we could be happy, for example, the work we do, we can be really happy we do it. We could be really stressed because it's really difficult. Yeah, so we have those conflicting emotions, but it's okay to have them. And sometimes we feel that, but if I like my job, why am I not happy 100% of the time? But actually, it's okay to have conflicting emotions, and being validated in that can be so empowering.
That's fantastic. Thank you ever so much. Is
Thank
there
you.
anything else that you'd like to add, just that you'd like people to be aware of?
I'd just like to add that, every feeling we have is very important, and taking this 5 minutes a day to do something soothing, something really important to you is really, really great, because we're really amazing at excuses. I know I am, but 5 minutes doesn't change the world, but it can change your life a lot, because it just adds a little extra to your day. And I also like to finish my days with saying something I'm proud of, because we don't give ourselves enough credit. I know I get up for work every day, and there are some days that are harder than others because, for example, it's raining outside and I really don't want to leave my bed. But then I have to give myself credit for that. Say, I'm proud because I got up and I did it. And, some days are difficult, but I still do it. And praising myself at the end of the day for that. Or even bigger things, I can tell myself, my goal is to go to gym once a week this week. And I do it, so I can praise myself for it, even if I didn't work very hard, but I did it. Yeah, so I think that's really great.
Fantastic, thank you. And I guess I'd finish just by saying that for staff who are struggling, I know you've already mentioned, we have Working Well, we have the Staff 2020 Hub, and health psychology as well. And we also have the employee assistance programme that staff can ring the number and get some personalised support there. And I'd always encourage people, if they're really struggling, obviously look after your health, go to your GP. Perhaps if you're struggling with low mood or anxiety, also the Let's Talk service or Talking Therapist service can be particularly helpful.
Absolutely.
Okay, so thank you once again for today.
Lovely. Thank you very much.